Hey everyone, and welcome back to our channel. Today we're diving into one of the key topics of the ANCC PMHMP boards, bipolar disorder. If you want to ace your exam and be prepared to make a difference in your future patients' lives, stick around and let's get started. So let's go over some quick definitions before we start. So let's describe mania. Imagine if you woke up one day and felt super duper excited, almost like you just had a mountain of candy. You're so full of energy that you might want to run around, talk really fast, and start a ton of projects all at once. This feeling can make you feel really happy and unstoppable, like you can do anything. But sometimes feeling like this can get a bit out of control. Maybe you might not want to sleep at all because you're too busy doing fun things or thinking about big ideas. And when you're feeling this way, you might make choices that aren't so great, like spending all your money on toys or saying things that might hurt your friends' feelings. So this is what mania is like. Mania is like having a superhero amount of energy and excitement, but it can sometimes make it hard to focus or make good decisions. It's important for people who feel this way to get help. What is the DSM-5? The DSM-5 stands for the Diagnostic and Statistical Manual of Mental Disorders. It's a big book that helps doctors and mental health professionals understand and identify different mental health problems. Think of it as a helpful guide or reference book. Just like a cookbook has recipes for making different dishes, the DSM-5 has recipes that describe different mental health conditions. Each recipe includes information about what the condition looks like and what symptoms a person might have and how long those symptoms need to last before someone can be diagnosed with that condition. For example, if someone feels really sad most of the time and has loss of interest in things they used to enjoy, a doctor can look in the DSM-5 to see if those feelings match something called major depressive disorder. The DSM-5 helps make sure that everyone understands mental health conditions in the same way, which is important for giving the right treatment and support. In short, the DSM-5 is a tool that helps people understand mental health problems better, so they can get help and support when they need it. Bipolar disorder is a mental health condition characterized by extreme mood swings, including episodes of mania and depression. There are three primary forms. Bipolar 1, which involves at least one manic episode, which can be preceded or followed by hypomanic or major depressive episodes. Bipolar 2 involves at least one major depressive episode and one hypomanic episode, but no full-blown manic episodes. Cyclothymic disorder, this is marked by periods of hypomanic episodes as well as periods of depressive symptoms lasting for at least 2 years. When it comes to diagnosis, you'll want to be familiar with the DSM-5 criteria. Here's what you need to remember during your boards. Look for distinct periods of elevated, expansive, or irritable mood. These mood episodes must last for at least a week for mania and 4 days for hypomania. Add in the need for significant impairment in social or occupational functioning. Always consider the differential diagnoses like major depressive disorder, ADHD, or personality disorders to ensure proper classification. Now let's talk about treatment. As a PMHMP, your toolbox will include pharmacotherapy and psychotherapy. Medications like mood stabilizers like lithium, valproate, and lamotrigine are a foundation. Antipsychotics may be used for acute mania, But make sure to monitor blood levels for lithium as it can be toxic. And also check for Stevens-Johnson syndrome with lamotrigine. Cognitive behavioral therapy, dialectical behavioral therapy, and interpersonal therapy can be effective, especially during depressive episodes. Remember, managing a patient in a manic phase can involve crisis. Safety is the top priority. Establish a safety plan and consider hospitalization if the patient poses a risk to themselves or others. Finally, let's go over important considerations for your boards. Stay up to date on the latest guidelines and research. This field is always evolving. Know how cultural factors and gender can influence presentations and treatment responses. Be ready to discuss ethical issues, including informed consent and shared decision-making with patients. We've covered a lot of ground today on bipolar disorder. Be sure to review these topics thoroughly and integrate your knowledge to provide compassionate and effective care to your future patients. Don't forget to like, subscribe, and hit that notification bell for more tips as you prepare for your ANCC PMHMP boards. Good luck, and see you next time.